This is a community analysis of Brooksville, Florida, presented by Andrea Lopez. This presentation will provide a brief historical overview, including the origins and evolution of the community now known as Brooksville. The structure, population, adequacy of health-related resources and their availability, environment, and government and public policy of Brooksville will be identified and analyzed. Furthermore, this presentation will illuminate and analyze issues which are present within the community, as well as address an issue that is faced by the community that is also faced globally, and compare and contrast how the community deals with the issue in comparison to its international counterparts. Fort DeSoto, which was a military fort, was established in 1840 as a means to provide protection to settlers from Indians. It was located in the northeastern edge of current-day Brooksville and about a half a mile east of what is now US 41. Water was difficult to access from the location of the community fort. As a result, the fort was abandoned. The population shifted to the town of Melendez, which was the capital of Benson County, now known as Hernando County. The Howell family settled in the northern part of Brooksville. The John L. Mays family settled in the eastern part of town. The Hale family settled in the west, and the Parsons family settled in the south of the city. The city was incorporated on October 13, 1880. Brooksville is named after Senator Preston Brooke, who was considered a hero because in 1856 he beat a northern abolitionist senator in Congress with a cane. The beating followed a speech in which abolitionist Charles Sumner gave a speech denouncing pro-slavery. Senator Brooke is said to have beat Sumner over the head 30-plus times with his gold-headed cane. The city was established by white settlers who set up plantations that relied upon slave labor. In the 1880s, America experienced a vast expansion of the railway system. Within 10 years, Florida increased its quantity of tracks from 500 miles of tracks to 2,489 miles of tracks. Major John Parsons, Christopher C. Keithley, John Joseph Hale, and W.S. Hancock worked together to form the Brooksville Railroad Association and the Brooksville Telegraph Company. In 1885, a train depot was erected in Brooksville. By the early 1960s, the tracks at the Brooksville depot no longer existed and the depot closed within several years. In 1991, the 1885 Brooksville train depot was bought by the Hernando Historical Museum Association and was restored as a museum for the public to enjoy. Brooksville was called the lynching capital of Florida and only second to Mississippi in number of lynchings across the United States during the Civil War. The recent burning of the Confederate flag in Brooksville sparked outcries from opposing parties, primarily regarding the flag and its symbolism in relation to racism of the Old South and the history and heritage of the city. Brooksville was formerly a hub of citrus groves and juice processing and once held the title of Home of the Tangerine. However, in the 1960s, the city's commercial, residential, and social activity declined. As a result, US 41 and State Road 50 were rerouted around the city, leading to a decline in traffic. Businesses shut down, and the community is now scattered with abandoned infrastructure. Architecturally, the city has remnants of its pre-Civil War origins, as well as standing structures from the 1870s to the early 1900s. As of 2014, the population of Brooksville was 7,778 persons. SHIP is a program intended to increase affordable housing construction and home ownership. The Multifamily Development Program provides loans to developers who plan to erect affordable housing communities within Hernando County. The Homeowner Rehabilitation Project provides help to qualified applicants to correct substandard housing conditions, such as building code violations, energy conservation, and correcting health and/or safety violations. The Down Payment Assistance Program helps qualified applicants meet their down payment closing costs. For homeowners who have been notified by their insurance company that they must have their roof repaired or face the loss of their homeowner's insurance, the Emergency Roof Repairs Program provides a 20-year, zero-interest deferred loan of up to $10,000 for qualified individuals. For qualified low-income families in the private rental market, assistance can be provided via Section 8 housing through the Housing Assistance Payment Program. The Family Self-Sufficiency Program was implemented to help Section 8 families become non-dependent upon social welfare via job training programs, subsidized. Brooksville has 5 elementary schools: Brooksville Elementary, Chocochattie Elementary, Eastside Elementary, Motown Elementary, and Pine Grove Elementary. The 3 middle schools of Brooksville are D.S. Parrott Middle School, Powell Middle School, and West Hernando Middle School. Brooksville's 3 high schools are Central High School, Hernando High School, and Nature Coast Technical High School. While data was not found for the other 2 schools, data shows that Central High School's minority enrollment is only 29% compared to Florida's average of 59%. Brooksville's only charter school is Brooksville Engineering, Science, and Technology Academy. Its schools listed as other are Endeavor and Discovery Academies and Hernando E-School. Based upon AP testing scores, the students at all 3 of Brooksville's high schools are far below the Florida average for college readiness. A Southern, primarily white, conservative community with a history linked to slavery, the Confederacy, and racism, prejudice, ethnocentrism, stereotyping, and racism may be more prevalent in this community. There is currently debate regarding proposals to change the name of Brooksville, given the name's rooting in slavery and racism as previously illuminated. The average unemployment rate of Florida is 5%. The unemployment rate of Hernando County is 7.7%. The poverty level for a family of 4 residing in Brooksville is 22.72% compared to the state's average of 16.3%. In 2009, 15% of Hernando County residents received food stamps. Unemployment can serve as the predecessor to aggressive behavior as a result of feelings of inadequacy, guilt, boredom, dissatisfaction, and frustration. This aggressive behavior can be targeted toward an intimate partner, resulting in intimate partner violence. Poverty in the United States has been linked to increased risk of uncontrolled hypertension, cardiovascular disease, stroke, poor mental health, and other health-related conditions. The incidence of cancer may be partially due to contamination, which will be addressed in a later slide. In 2013, 68.7% of adults in Hernando County were either overweight or obese, and 39.4% of the county's population lived in a sedentary lifestyle. 35% of the county's population had been told before that they have had high cholesterol, and 38.3% of the county's residents had hypertension. 19.5% of the county consisted of smokers in 2013, and 45% of the county consisted of former smokers. 16.6% of the county's residents engaged in heavy or binge drinking of 2013. Oak Hill Hospital is an emergency care facility that specializes in heart and surgical care. It has 234 beds, and in 2015, its emergency room served 38,104 patients. Bayfront Health Brooksville consists of 257 physicians, 500 associates, and 150 volunteers. The hospital has 120 beds and 60 private rooms. The hospital provides state-of-the-art technology including high-speed CT scanners, digital mammography, robotic surgery, dual cardiac catheterization suites, and nuclear imaging cameras. The Florida Department of Health has a Brooksville office that offers assistance and service pertaining to clinical and nutrition services, wellness programs, environmental health, emergency preparedness and response, and infectious diseases. The Nature Coast Community Center is a collaboration with the Florida Department of Health. It was established in 2005 to achieve Healthy People 2020 goals. Hernando County Health and Human Services provides services to help alleviate the human and social service needs of Hernando County residents. C1 seeks to reduce the overall cancer death rate. This objective was chosen due to cancer being the leading cause of mortality in the county and the high rates of cancer incidence in the county compared to the state as a whole. The selected environmental quality objectives seek to reduce hazardous contamination and pollution. EH 20.1 focuses specifically on exposure to arsenic, which exists in significantly high levels in Brooksville. These objectives were selected due to the abundance of brownfield sites in Brooksville and the hazardous exposure these sites present to Brooksville's residents. The final objective seeks to improve the health, function, and quality of life of older adults. It was chosen because Hernando County contains one of the oldest populations in the state of Florida. The water in Brooksville and all of Hernando County is provided via a Florida aquifer that is utilized by the Hernando County watering system. The county complies with rules and regulations imposed by agencies such as the State of Florida Department of Health for sewage disposal. Mosquito control is the county's primary vector control. According to the Environmental Protection Agency, a brownfield site is defined as real property, the expansion, redevelopment, or reuse of which may be complicated by the presence or potential presence of hazardous substances, pollutants, contaminants, controlled substances, petroleum or petroleum products, or is mine-scarred land. The direct impact of the brownfields has not been determined. However, the contamination is believed to have a direct correlation with the cancer rates in the county, as illuminated in a prior slide. On June 7, 2012, the Environmental Protection Agency awarded Brooksville a $400,000 assessment grant for the cleanup and redevelopment of its brownfield sites. Brooksville and its Brownfield Community Task Force has been identifying polluted sites and plan to apply for more grants and potentially redevelop the brownfield sites. The citizens of Brooksville elect 5 members of the Brooksville City Council, who are elected to 4-year terms and may only serve 2 full terms consecutively. From the City Council members, a mayor and vice mayor are elected on an annual basis. The Hernando County Meeting Portal website provides video of prior government meetings, as well as provides a downloadable electronic document of the meeting's agenda and agenda packet. The location of the upcoming meetings are listed on the same website. The meetings can also be viewed live via the Hernando County Government Broadcasting Channel. Email and often telephone numbers are provided for government officials and groups. The meetings appear to be geared toward the redevelopment of Brooksville and tourism. Brownfield sites are dangerous to public health and pose environmental hazards. The health effects and severity of the contamination in relation to the higher cancer incidence of the county is yet unknown and alarming. The death rate by cancer is also significantly higher than the average of the state, coming in at 186.2 cancer-related deaths a year between 2006 and 2008. Cancer is the prioritized problem of the community by the author. It may be the effect of the brownfield sites in the city, hence the prioritization of the brownfield sites. Education is imperative to diffusing health disparities and can be a tool in combating poverty, unemployment, and even racism and substance abuse. Brooksville students may be less prepared for the expectations of college and have an increased need for college remedial courses. In August of 2011, the unemployment rate of Hernando County was 13.9%, 3% higher than the average of the state. Brooksville's average unemployment rate is suspected of being even higher than the average of the county. By 2009, there was a 171% increase in food stamp usage over a 2-year period. Poverty is linked to health disparities, and costs of care was cited as one of the primary reasons residents of the county didn't see a physician. Heavy or binge drinking is a risk behavior that is of significance in the county. This behavior may be linked to the cirrhosis rates in Hernando County, which are one of the leading causes of death in the county. Given Brooksville's large white population, tiny minority population, and history, ethnocentrism, stereotyping, prejudice, and racism may be present. 836 million people around the world live in extreme poverty. Each day, about 16,000 children die around the world before their 5th birthday. Brooksville offers numerous services to low-income individuals and families. Brooksville offers the Head Start program, which is a program for children 0 to 5 years of age of low-income families. The program promotes school readiness. Brooksville is just one community internationally that faces poverty every day and which has implemented programs to assist low-income families, especially those with children. In Korea, the government-sponsored Dream Start program helps vulnerable groups such as low-income and single-parent families with children ages 0 to 12 years of age to escape poverty by providing physical health services, cognitive language services, emotion behavior services, and family and integrated services. Korea also has community child care centers that provide space at all times to children of low-income families. The child centers provide lunch, sanitary guidance, and protection from poverty and neglect, school guidance, reading guidance, tutoring, and physical education, and counseling, amongst numerous services. The aforementioned services are very similar to the services offered via Head Start. In Bangladesh, microfinance as a means to help the ultra-poor has been attempted. However, even with flexible repayment schedules, consumption, smoothing, production loans, and extension and training services, the poor are at an increased risk of going further into debt and becoming poorer. Direct food and cash transfers have been effectively utilized and can be utilized with or without conditions. such as requiring or not requiring a household to meet certain stipulations, such as a child being required to attend school in exchange for food or cash. Nurses can work with the local government and its programs to make the community aware of the nurse's presence and roles and the services that are available to the vulnerable population, so that the population is more inclined to seek assistance that can improve their health and propel them toward greater autonomy.